The list of minor ailments that pharmacists can treat could soon be getting longer as the government continues looking at ways to ease pressure on the healthcare system. But a group of family doctors is pushing back.
This is a risky game that the government is playing. And we need a system where people can get the care that they need, where people can see their doctor.
Ontario pharmacists have treated more than 1 million minor ailments since their powers were expanded last year to include conditions such as pink eye, hemorrhoids, and urinary tract infections. And now 14 more could be added to that list, like sore throat, mild headache, shingles, nail fungus, and swimmer's ear. The proposed scope expansion would also allow pharmacists to administer more vaccines and order some lab tests. And this has a group of doctors raising concerns.
The number of times that I've seen people with one of those things that you have on the minor ailments list, and they initially thought it might be something minor, but it ended up being much more serious.
The president of the Ontario Medical Association says the Ford government's focus right now should be building medical teams, expanding capacity, and getting 2.5 million residents a family doctor.
Doctors get years, thousands of hours in training and how to diagnose, how to treat. And then, by the way, if you have a family doctor, that's your front door into the healthcare system. You can get referrals, imaging, all these different things, all these connections into healthcare that you just can't get at a pharmacy. So this is a Band-Aid non-solution.
Ontario, though, is catching up to other provinces like Alberta, where pharmacists have been diagnosing and treating minor ailments for more than a decade.
I'm disappointed by some of the messaging coming out formally from the Ontario Medical Association, suggesting that there is an increase or introduction of patient risk.
The CEO of the Ontario Pharmacists Association says the program here has been successful and pharmacies are gearing up for expansion.
So we know from the data that this can be done safely and effectively. We have a great utmost respect for physicians and we see them as very much collaborative partners in the healthcare system.
And the Ford government claims this will be a big money saver, with pharmacists charging OHIP $4 less per visit than doctors. Shauna Hunt, City News.